There it is. All right. Hello, everyone. Welcome. We're so glad that you're joining us today for this live Q&A with David Ford. As we dive into this important topic and we kind of kick off April as HIE Awareness Month of engaging elected officials for HIE advocacy. So April's all about hope and action. Yet we know advocacy can feel overwhelming for a lot of people, especially if it's something that they want to do but don't know how to do. But at the end of the day, it's one of the most powerful ways to create change. So that's why David is here with us today to break down his process, share what's worked for him, give you the tools and confidence to take action. And so as our board president, he's going to be talking about how to build relationships with policymakers and advocate on all of the levels, local, national, international, you name it, and how to craft key messages that make your voice heard, that make an impact. So he's been a huge advocate for the HIE community for a long time. He's used his voice to push for better policies and increased awareness and stronger support for HIE families. So today's all about helping you feel empowered to do the same. So with that said, let's get started. David, thank you so much for being here with us today.
Well, glad to be here. Appreciate it.
Yeah. Before we get into the advocacy portion, we always start off our Q&As with just asking for a little bit of history and interest. So in this case, in this context, if you could explain your connection to or your role also for Hope for HIE and specifically what inspired you to advocate for HIE change.
Sure. Well, I've been involved with Hope for HIE now for a little less than 10 years. My daughter was born. She's 10 now. She was diagnosed with HIE at birth. My wife found Hope for HIE while doom scrolling, I think while she was nursing. A couple months after we had Scarlett, we got connected. I had a background in nonprofit work, so I reached out and offered to volunteer. And the early years, I was in and out of volunteering just because there were a lot of demands in my life at that time. And so I guess consistently I've probably been involved for about 8 years as a board member or very active volunteer. And I've been board president now for a little over 4 years. This is my 5th year as board president. And I enjoy it. The reason I do it, I think initially for me, it was a way to channel some of the grief and the struggle that I was feeling at that time. And, in hindsight, it gave me an avenue. I felt so powerless in the early days, and there was so much left up in the air and unknown. And, I could do things to support my wife and my daughter and my older daughter. But in the end, there was a lot that made me feel powerless. And so volunteering was a way to kind of channel that and potentially turn that into, positive and some impact. And 10 years down the road, it's a different world. I just spoke to a new father recently who described his experience, and it was much different than mine. And that, I think a lot of that can be directly attributed to the advocacy and the work that we've done in the past decade to really grow Hope for HIE and expand the reach and really reach some of our goals.
Absolutely. And that mirrors something. I was just talking to Betsy, for those of you who don't know, our executive director last week. She said something that mirrored exactly what you said. My experience, 13 years ago shouldn't be the same as what the experience is now. And that's a good thing, right? That's supposed to
the
be
goal.
reflective, right, of the change and of things like this. So as we move on to this next section, thank you for sharing that. Sure. We're just going to start with advocacy at the different levels. So our first question in this area is, are there any particular policy areas or legislative actions where you see a need for more advocacy regarding HIE, just to give a little bit of context before we jump into it?
Well, I'll start by saying that, I think most parents like myself had never heard of HIE before their child was diagnosed or they experienced the impact of hypoxic event on a family member. So I think at a fundamental level, just increasing awareness. I mean, because HIE is not a particularly rare thing. 2 to 3 out of every 1,000 live births is not particularly rare. In some places, it's considered rare. In the United States, that's not considered a rare disease by most definitions. And then from out of that diagnosis sprout many other potential diagnoses, depending on the circumstances of the individual child or person that's diagnosed. So, so I will say, at a fundamental level, awareness universally is important, and that's one of the things that I'm going to stress here. Your story matters. Speaking up matters in any capacity, whether it's at whether it's at school or in the community, or at a local park, and interacting with family or friends and their children, and identifying the differences between your child and their children, and how they can sort of accommodate that in play and other things. I mean, any act like that can make a difference. And I think I'll speak specifically about the United States right now. I think regardless of your political views and where you kind of sit on things, this is a very active and uncertain time. And so, there are a list of things that are going to change more than likely, or have changed already, and we're not really sure how all that's going to play out. Things like research, education, health insurance. There's a long list of things that have the potential to look much different a year from now, 10 years from now. So I think to list individual issues and areas where advocacy is necessary is challenging right now, because there is a lot of uncertainty out there. So I'll just say, and our families deal with a great deal of uncertainty to begin with. So to layer on top of that societal changes that could impact them dramatically there's a lot of stress and a lot of tension. I see it in our community. These concerns are real, and they have potentially major impact on people's lives.
Absolutely. So what are some examples of what you would consider successful local or state advocacy efforts related to HIE that you've been a part of yourself, or that you've seen happen? I know you were just sharing with me news before we hopped on.
So I'll just say, I'll step back real quick. We're talking about elected officials. The title of this program is engaging elected officials, but advocacy can look different and take many different forms. I think in terms of legislative advocacy, Hope for HIE has been involved with quite a bit. We sign letters of support. We certainly support families that are doing things in specific states on specific issues whenever possible. But I think there's the best examples I can give you are issues that we've been able to impact dramatically in the research area, more broadly in the community. So, for example, one of our major goals 10 years ago when I first got involved was to be able to connect families as quickly as possible to reliable, credible information and a community that could support them as they proceeded along their HIE journey. And so that was a goal then. And I referenced this earlier. I had a conversation with a dad the other day, and within a very short time of getting the diagnosis of HIE, he had a pamphlet in his hand and someone was talking to him about Hope for HIE, and he got connected to us immediately. And again, 10 years ago, when my daughter was born, that didn't happen. It may have happened some places. It didn't happen where Scarlett was being cared for and our family was. And frankly, it was one of the top NICUs in the world. And we still didn't get that information handed to us. We would have now. They do that now, but they didn't back then. And that change is a result of the grind that we've carried on for the last 10 years to connect with hospitals, to have families reach out to their providers, to make those connections and help people understand how important, meaning medical providers, the support staff at the hospital, social workers, things like that, how important it is for that family to get connected. I have no doubt that getting a family connected to support and information through Hope for HIE improves outcomes. It might be very small, it might be a major way, but I can tell you right now that change has been dramatic. So that's a really grassroots effort that's taken many years to take shape. But I think it's a great example of the work that we've all done as a community to just make those little inroads day in and day out at hospitals and doctors' offices and schools and other places. And that's a really an example of something that's made a dramatic change. Another example I'll give you is, we've been a leading organization in the development of an HIE registry, so that there's a way to track health trends, treatment outcomes, and the needs of our community. We're in the early stages of that process. We received a grant to begin to develop that HIE registry. So it'll be a repository for patient information that researchers and providers can use. It's obviously all anonymous data, but they can use that for research. We can look at trends throughout the community. We can look at long-term outcomes. And currently, no long-term outcomes exist. That's another place we're pushing hard. We have a work group now working on establishing long-term follow-up guidelines for HIE families. Depending on what provider you're with or what country you're in, follow-up for HIE could look much different. Typically, children are followed for a couple of years, and then it's up to
Right.
The will of the provider to do that. Anything beyond that. We've also developed a Halo support that's become an emerging trend in research. So we basically work with a researcher or providers to provide support around and education around a family that is engaged in clinical research. These are all things that didn't exist before and are going to exist in the future, or are beginning to take shape because of the work we're doing. A specific governmental action. It's something that I've done a couple times now, but I try to engage my legislators both at the state and the federal level in understanding and being aware of and supporting HIE Awareness Month. I just got an email back from my state representative a few minutes before I got on this Q&A to confirm that a resolution will be passed in the Pennsylvania House acknowledging HIE Awareness Month. This representative will present that resolution on the floor. I've been invited to Harrisburg to be there as a guest. There's a partner bill in the Senate in Pennsylvania. We've reached out to the governor of Pennsylvania for a letter of support. I have a call tomorrow with the United States Congressman or a representative from his office to discuss HIE Awareness Month. He's a pretty open-minded legislator when it comes to rare disease treatment and research. So I think he's going to be interested in what we have to say and the inroads that we've made and the change that we've made in the world. So those are just some examples of the work we're doing. There's many, many others, and I'm sure there's lots of others throughout our community that I'm not even aware of that people are grinding away on day in and day out. So I hope that's helpful.
Oh, yes. And, throughout the month of April, we have HIE Awareness Month ambassadors who are also sharing a lot of their advocacy efforts too. So that's something that, for people who don't know what action they're taking, you'll find out the second week of April for me, because that's when I got to get a schedule out for. So stay tuned. So let's move on to specific strategies for engaging elected officials. I know there's many sub questions here, but in your opinion, as someone who's been in this space for a minute and is so active in this space, what are some key strategies for effectively engaging these elected officials on behalf of HIE families? There are many things we can touch upon here, so I'll read them off for you. Specifically, how can families approach their elected officials to build meaningful relationships and advocate for HIE causes? Let's start there. We'll take it slow.
Sure. I think from my experience, and there's a letter that I wrote that we're going to use as a template that I believe is going to be shared on our blog post. I start, I do an old fashioned letter. I type it up. It's a couple pages long. I hit some of the key points about Hope for HIE and the priorities we have, things like the registry and the long-term outcomes, things that I know we've made progress on that are tangible, that are good examples of our ability to execute when we have an idea or we see a need in the community. And then I personalize it. I go back and I say, I talk about the experience we had with our daughter, early intervention. In Pennsylvania, there's a loophole in Medicaid. Well, they literally call it the loophole, where certain diagnoses, regardless of income, your child qualifies for medical assistance without any without any pause. And Scarlett qualifies for Medicaid. So in addition to the private insurance that we pay out of pocket for, she has medical assistance that picks up some cost of her health care. That's huge. And for some families, that is an incredibly high cost that Medicaid can pick up for them. So that's a invaluable resource in our state, and it's available in some other states. Some states have the loophole, like we do, some don't. But sharing with them the impact that sort of thing has on a family like ours in real life terms is, I think, a way to connect with them and make things real. Because, I think a lot of us, when we're sitting there looking at statistics or reading an article about trends, or we read about home prices or cost of living or, whatever, they're numbers on a page. But when you talk to somebody about the impact of having access to medical assistance as a supplement to private insurance, and what that means to your family and the impact it's had on you is a tremendous thing. And I mean, in most cases, at least with our state legislators, her office is, I don't know, 2 miles from my house. She graduated from the same high school that I went to. So I think to personalize this stuff and take it down to a level where they understand and they can see the difference these programs and supports make in our lives is an important thing, because, there's a lot of noise and a lot of interests out there that they hear from every day. But when you sit across the desk from somebody and say, this is how your decision impacts my child, I think that can have a tremendous impact. So, I think being specific about the impact programs that they have influence over, impact your family, is important. I also talk a little bit about some of the challenges that we've had. Special education in our school district is well rated, but it's been a struggle. In our personal experience, we've had a difficult time getting some of the supports that we need in place for our daughter. I'm not quite sure why, and I shared some of that frustration with her. I don't, we've also shared it with the school, and I don't know that there's a lot she can do about those things, but I think it's important as we navigate some new realities in the educational system that I believe are probably forthcoming, that she keep in mind that special education is important for a child like mine that has learning differences. And so not all children have those needs. In fact, my older daughter, school is relatively easy for her. Yeah. My younger daughter, it's a different experience, and we have to advocate for her. So I also think that when you talk about, make sure that you bring both positive and challenging experiences to the table, because we all have a mixed experience. Some things go well, some things don't go so well. So when you can share both positive and not so positive experiences, I think it's helpful. And if you can come with solutions, like for me, one of my frustrations with special education was that there were services that we weren't made aware of that my daughter would have benefited from. And I don't really understand why nobody told us about them until we kind of heard through the grapevine about them. And so that was frustrating. And she said to me, well, what would make that easier? I said, well, I don't know. When you go to the restaurant, they give you a menu.
Right.
I don't know if that's a practical solution, but it seems like maybe there should be some high level explanation of what services are available.
Absolutely.
Just in case you can look at it and say, hey, that makes sense. She said, that's not a bad idea. And if nothing else, it's on our radar now. So I think things like that are, I think those are important. I think personalizing as much as you can it makes a big difference when you're talking to legislators. And then, I follow-up's important too. Like she in fact was the first person I heard back from. I didn't hear back from a couple others, and I reached out, followed up with a phone call and an email. And then, in fact, one of the others was working on a resolution. The other one got back to me to schedule the meeting right away. So, there's a lot of, I know that I've heard there's been a substantial uptick in the volume of calls and emails that legislators at all levels of government are receiving right now, because I think it's a reflection of the uncertainty and some of the, the volume of changes that are on the table right now at the federal level. And that just trickles down to the state.
Right.
So
that was amazing advice. And I feel like, in this next question here, you may repeat some of the things you've already said too. But in addition to what you suggested, are there additional actionable steps that HIE families can take to craft clear and compelling messages to make their voices heard? I feel like, personalizing it, talking about
Yeah.
the positives and negatives. Is there anything else that you feel like falls underneath that category that you'd like to share?
No, I'll just reiterate. I think really be as specific as you can. If
Yeah.
there's a speed bump that you're encountering or a roadblock that you're running into or something that's made your life dramatically better, I think trying to be as specific as possible is really helpful
Yeah.
because the legislator that you talk to or the advocate that you're going to talk to in someone's office is going to ask you, what's the issue and what can I do about it? How can I help you?
Right.
And they're very, I think if you can make it easy for them to say yes and, oh, that's a great idea, then that's a recipe for success. Because going in there and confronting them with all the challenges and not, and laying it at their feet and saying, this is your fault, you do something about this, that's one way to do it. And I think there's a time for that because sometimes people, some things are really frustrating and it can be overwhelming. And sometimes you just got to let them have it. And I think that's a strategy that I've used sparingly, but there's been times where I've been overwhelmed that I didn't know who to talk to or what the solution was. And I just said, I don't know who to talk to about this, but this is awful.
Right.
But the easier you can make it for them to say yes, the better. And the clearer you can explain why it's a challenge and the impact of a decision they've made. For example, with my state rep, I'm not sure what's going to happen with the Department of Education. And
Right.
I mean, I know there's things in the pipeline. I have no idea how all that's going to shake out. But what I said to her was, I'm really counting on you to be a backstop. If there's a possibility that the protections and supports that my daughter relies on to be successful in school go away at the federal level, then I need you as a legislator in my state to be the backstop and to support her and make sure that those things are there for her at the state level. And if that's not a possibility, I need you to tell me that and tell me why and tell me how I can help you figure out how my daughter can have access to a free, appropriate public education. And, I think that's, for me, just kind of laying on the line and saying, this is my expectation and I'm here to help you. If you need my story or you need my support or you need me to speak out about my experience, I'm here for you. Offering that support can be invaluable. Those personal testimonies make a difference.
Yeah. And what challenges would you say that either you've experienced or you would foresee maybe other HIE families experiencing when advocating for HIE and talking to elected officials? And then what suggestions do you have for them to overcome some of those challenges, if you have any?
Well, I have a feeling that there's a lot of folks in our community. I know for a fact, and then it's probably a much greater and more complex issue than I can imagine for a lot of families. But there's a burden on a lot of us that from the care and the attention and the stress and some of the other things that impact our lives as a result of a hypoxic event. That can be overwhelming. So even finding space to advocate can be tough. But I think so finding a community of people local to you or in the same affinity group or someone with a similar need can be helpful because then you can offload some of that burden and share it and brainstorm and empathize and listen and grumble and complain and do all the things that we need to do sometimes with our peers. So I think trying to figure out if and how you want to take part in advocacy, because there's not every person has room for that in their lives, and that's totally understandable. But if there's a compelling need that you see and you would like to impact or change, then I think it's incumbent on you to do that because together, all our voices collectively can make a huge difference. They have made a gigantic difference over the last 10 years. It's a far different world now for HIE families than it was 10 years ago. I can tell you that for a fact because I've lived it. And I can imagine in 10 years, there's going to be somebody on a Q&A like this that's going to say the same thing about the last 10 years and the 20 years. So I know it's frustrating and I know it's overwhelming and I know it's uncertain and it's scary. It's a scary time. It's upsetting. I get really upset when I think about the impact some decisions that have been made or will be made could impact my daughter's future. But I just have to remember that you can really only act on the things that first of all, there's a lot of noise out there. There's a lot of uncertainty, but you just have to kind of take it in stride and say, this is a concrete thing that's happening now that's going to affect my child's life. What can I do about it? Okay, here are the steps I'm going to take. So just try and keep it in perspective. And it's funny because the couple of legislators I've talked to have said, well, nothing's really happened yet. No, you're right, it hasn't. But that doesn't mean it's not stressful. So I think trying to prepare yourself to deal with those decisions, whether they go your way or not, is an important step. But so I do think, trying to keep it in perspective, take action on the things are tangibly going to impact your family, and allowing yourself to do what you can, where you can, when you can. Even if it's just an email to your teacher saying, man, I don't understand why such and such is not part of the curriculum, or we're really struggling with this at home. Like, that's advocacy. That makes a difference. Even the little things. And because, there's ways that people can do things that will make your experience better and your child's experience better and make life a little easier for you. I think in a lot of ways, it's just a matter of trying to influence those things in a way that can maybe make change for the rest of us too. Absolutely.
And I know before we officially conclude this too, if there's anything, any other strategies or any ideas you have to ensure that families' messages, their voice resonates with people, we would love to hear that if you haven't said it already. And then in addition to that, any resources that you recommend for families new or interested in the advocacy process, where you recommend they go, what they look into to help?
Sure. I don't want to overwhelm people. There's a lot of repositories for people who want to take legislative action or contact their legislators in terms of issues. You can go online. Little Lobbyists is a good resource. 5 Calls is something I've heard about recently. You can find those resources. My first advice would be figure out who your state legislators are, figure out who your federal legislators are, figure out who your governor is, familiarize yourself. You could even just introducing the fact that you're an HIE family and it's Awareness Month in April. If you do nothing more than that, that's a huge thing, because they're aware that you live in their district and you represent a certain community, and you can share your perspective, even taking those little steps. Our hope is that in the near future, we'll have an advocacy hub that will be available to our families through the website that they can go to find resources and actionable items. In the meantime, our blog on the website is a great resource if you want to learn more about, the things I discussed in terms of HIE follow-up guidelines, the registry, anything like that, any of the stuff that we're working on that's cutting edge, even the Halo support model, all that stuff is there for you. I encourage you to read up on it. It's those things and many other things. If there's something that sticks out to you or that you benefited from through Hope for HIE, make sure they know that. Let them know that you're part of a worldwide organization that represents countless families around the globe. So I don't overwhelm yourself. Start locally, start small, take one step, look at the template letter that we share, maybe use that to reach out to your state legislators. It could even be your township supervisors or your county officials or wherever, whatever your municipality happens to be. But yeah, so.
And we're working on additional templates too, because we know we have your letter that we're going to break down and kind of, as a former English teacher, I'm like so ready to do that, like annotate it. I'll do that for everyone else in case they're like, no thanks. But so break it down and understand like what goes where and how to formulate a message. But there's also something that we're creating too. If there's someone you're about to speak to an official or legislation or whatever, if you email us, we can help provide those key messages for you too. I mean, I know Betsy just did this last week with someone who reached out and says, I'm speaking to someone at my state level and I want to know what's going on with HIE. And we gave her a list of resources. We gave her a list of messaging and things to say, what's in the pipeline of what's happening, what processes look like specifically in her state. So we can help formulate those for you too. And the goal is to have all of this on the blog, and the key takeaway, of course. And then ideally, we plan to, fingers crossed, launch an advocacy hub, kind of like we have a support hub. We have a clinical trial hub. We would love an advocacy hub to launch after April. Let's give ourselves grace, May, June, July, July, August, with these resources and these ideas, so that families can go to and see what they think they can, is within their bandwidth, lies within their interests or affinities. So that's something that we plan on launching too. But with that said, one last question we have for you, David, is how do you see the role of HIE advocacy evolving in the coming years? And what do you believe is next for Hope for HIE's advocacy efforts?
Well, I think that we can begin to take more decisive action on legislative matters. There are some in our community who are already doing that in great ways, in both in, as far as research goes, disability rights advocacy. I'd like to see that become a more mature part of our work. So much more. I mean, our voices become so much louder and more certain over the past 10 years. I mean, we've made tremendous progress, and there's some amazing things that have happened. That momentum will continue. And I think the more people we have willing to share their stories and give their perspectives and are empowered to be part of this positive momentum that we've enjoyed for many years now, the better off we'll be. I just see that going to continue. And I think having a more organized, call to action when we know there's something affecting families in a particular geographic area, whether it be a country, a state, I think that's something that we can look at down the road, at least partnering with other organizations. We sign on to gobs of letters for various issues. And we do lead some of those efforts, but, I think a more organized effort in that area is somewhere down the future line.
Absolutely. Well, thank you everyone for watching this. And David, once again, thank you so much for sharing your insights and your advice and experiences with us. So just to end on, another positive note, every voice matters. And I know that I know you believe this too. Together, that as a community, we can drive real change for HIE and our community members. So thanks everyone for joining us. So keep speaking up, keep advocating, and learn more, especially with our Hope in Action April Awareness Month theme. So stay tuned for family stories, resources, and other medical advisory board Q&As to hear from our providers about specific HIE topics, as well as how they believe they've seen hope in action. So thanks, David.
Thank you.
Bye, everyone.